And welcome back. Well, colorectal cancer is one of the 5 most common cancers in men and women in the U.S. The good news is it's preventable. And if it's caught early, it's treatable and beatable. So here to help bring awareness about colon cancer is Dr. Julia Leo with GI Associates. Welcome to the Morning Blend.
Thank you. Thanks for having me.
This is, I think, one of those silver lining things that if for some reason, you do the screenings and you follow the proper time frames, colon cancer is preventable and it's beatable, and that's one of those things that I think people can be excited about in a way.
Right, and yeah, and that's, you've hit on really the key to this particular screening test is it's preventable, and that's a key difference with the colonoscopy is by removing polyps before they become a problem, it really saves people from developing a colon cancer potentially.
A lot of people, in fact, 1/3 of people don't get screened. Why do you think it is that people just do not go in and take care of this and look to be prevented?
I think some of it stems from people's anxiety about the test itself. The test has changed a lot over the years, but sometimes people have heard things in the past that make them apprehensive, and I think that things are changing and they should look into getting it. Like you said, 1/3 of people are not getting their colonoscopies. There's an initiative by 2018 to get that up to 80%. So we're working hard to get more people screened.
What do you think are some of the myths or the reasons that people won't do it? I know, and because truthfully, I think they are myths, and a lot of the ways to have a colonoscopy now are not as invasive, I guess, or painful or scary, or the drink that you have are not as what people used to say it was like, right?
Right, yeah, and I think one of the things is discomfort. People are obviously afraid of being uncomfortable during the test. And so, the scopes now are more flexible than they had been in many years past, so that makes it more comfortable. In fact, last week I did an unsedated colonoscopy on someone. They were quite comfortable during the entire test.
Did they request that?
They did request that,
okay.
Yes. Yeah, so there's varying levels of the sedation or how much medication we use to get people comfortable. So there's a lot of ways we can kind of tailor the test to what the patients prefer. And that's an easy discussion to have with your GI doctor. And so that's one of the things. I think the prep is another thing people don't look forward to.
The prep is the drink, right?
Right, right. That we purge the bowel with and get everything cleaned out because we want to make sure we're getting a really good look inside the colon. We don't want to miss any cancer or polyps while we're in there. And so in the prep also, some of the taste has been changing. The volume of the prep is less, and so it's a little bit more appealing. Because
isn't it true you can even use almost like a sports drink nowadays for the prep?
Right, yeah, you can do a couple liters of some laxative mixed into a sports drink, which is for most people very drinkable and an easy thing to do.
Absolutely. So let's break it down about when you should be screened, the timing. What's the age frame that people should look to schedule a colonoscopy? Okay,
so an average risk patient should be screened at age 50. People that have a first-degree relative, which is a parent, a sibling, or their children even, that have a history of colon cancer or colon polyps should be screened earlier.
Okay.
And so then basically that would be age 40 if it's less than 60 that the first degree family member was found to have a polyp or a cancer, or 10 years before the diagnosis, whichever age is earlier.
Does it matter the gender? So I told you during the break, my father had polyps when I think he was 52 when they had found them. So for me, I'd be looking at 40, 41, 42 to have my first colonoscopy. Does that make a difference that it was my father versus my mother for a child when you say first relative?
No, actually men and women are both at risk for colon cancer, and so it's recommended that despite the age of the relative, that you should be screened no matter your sex. Yep, at age 40 in your case.
And polyps don't necessarily have to be something scary, right? Oftentimes you see them, maybe they have to be removed, or do they always have to be removed?
Generally we would remove all polyps, and basically the reason is because some of them are precancerous and could develop into a colon cancer. And so the way we definitively find that out is by submitting them to be looked at by the pathologist, and they tell us more information, and that affects the interval of screening as well. So,
how long does a colonoscopy take? Because I think there's so much fear, but it's a relatively quick procedure, isn't it?
Yes, yeah, it's usually about 15 to 20 minutes.
So quick.
Yeah. A lot of people actually, I go back to the recovery area and talk to them, and they're surprised they've had their test already.
Yeah.
So I show them the pictures and So a lot of people are quite comfortable, and it's a quick, easy test, and so not a big deal in a lot of cases.
And very important. I think that's the big thing to drive home, that this month is truly an awareness month for a reason, because this is one cancer that does not need to take lives.
Right, exactly. Yep, 90% of these cancers are preventable, and the key with a colonoscopy is catching it early. At that time, 5-year survival is 90%. And so if we catch these things early, people do much better.
And at GI Associates, do the people have to be referred to you, or can they just come to you directly at one of your locations?
Yeah, they can come to us directly. We have many locations throughout the city and the suburban areas, and different types of places people can get testing. So there's a lot of options, and we strongly encourage people to look into it.
So age 50 if you have no relatives, but otherwise if you have a first connected relative, make sure you do it 10 years prior to when they found an issue. So schedule your colorectal cancer screening this month. Get it done. Don't be afraid. Go in. It's easy. WIGIA.com. There's 19 area locations as well for GI Associates. Just don't wait. Thanks for being here, Doctor.
Great. Thank you.
Appreciate it.